Recording it starting now. Okay. Okay. Well, let's go ahead and get rolling here. Today we're going to dig deeper from the last session. We're going to dig into how to create an operational plan. What are all the different levels of the pyramid? Some real examples, by the way, from public health around the different examples of the pyramid. So let's go ahead and first of all, Merry Christmas to everybody. It's coming up quicker than I thought. I realized I haven't finished all my Christmas shopping yet. So I told my wife, I said, I need a list by tonight. And she said, you're not going anywhere. You can get on your computer and go to Amazon. I said, yeah, well, okay.
Thank you, Merry Christmas. I appreciate the Christmas card, Fred. I didn't have a chance to send this to the team yet, but I did receive the card, and I was going to share this with the team. So thank you.
Thank you. Thank you. Okay. First of all, let's go ahead and review the planning model here. So the top, the organization is just your health department. Typically, there's one of those. We do have some health departments who have multiple domains in there, but typically it's one. And then the groups is the basic structure of the health department, plus what we call the primary plans, or what FAB calls their six-pack of plans up there in the bubbles. And let's just for kicks go to your group screen. So this is your group screen up there, starting at the top with the department. You see the FAB six-pack of plans underneath here. And then you see the reaccreditation plan for version 1.5 as well as 2022. Hang on one second here. I forgot to take the copy when I copied it on here. Okay, I didn't see that. It's all fixed. Okay, and then we have community health division. So again, the levels are, one is the top level, and they go down to level 10. Nobody's ever gotten past 5 or 6 to the best of my knowledge, but a level 2 group will always report up to a level 1 group, 3s to 2s, like you see HR reporting up into finance here. So this is basically the group. Down here at the bottom, I added a new, what we call a training sandbox. So it's a group that we'll be using during the next 2 sessions here to actually input plans in the system. And today, at the end of the training, we're actually going to go in and input a plan. That way you can see all the different button pushes and all the different screens we have to go to. Underneath the groups, then, each group has a set of services or initiatives, and this is kind of typically where a lot of the plans start at the service level. Again, services are ongoing things. I use the example of WIC. WIC has been around forever, will continue to be there forever. Initiatives are future things that we're trying to accomplish. We have the example of tobacco cessation. We'll kind of refer to that example again today, and we're calling that an initiative because it's a program that we're going to be rolling out in the future. That each service or initiative has a set of goals. Goals, again, are high-level definition of what we're trying to accomplish. SMART objectives, again, SMART is specific, measurable, attainable, realistic, and time-based. So the SMART objectives are the definitive target as to what we're trying to accomplish, down to the real excruciating detail. And then activities are merely the set of steps that we believe we're going to go through to get to the objective. So that's the pyramid. Now, the nomenclature that you see on here is pretty standard, but it's not cast in concrete. We have seen plans, from public health departments all across the nation that have different versions of this. There's no right way and there's no wrong way. This model's been around for 21 years that I've been in public health, and it seems to be pretty well fixed. However, again, I've seen different variations. So people will send me a plan and I'll look at it and I can see the variations, but it's usually pretty easy to figure out, what the coinciding version in the pyramid here is. So I'm going to walk you through some of those examples just so you can get an idea. And the idea here is somebody comes up to you and says, here's our new community health improvement plan, put it in the system. And you look at the nomenclature and it's different. So just how do we do that? So first of all, here's one of them: strategic priorities, where we call services or initiatives, goals, strategies instead of objectives. I'm not big on that one. The reason, to me, strategies are how we get someplace, not necessarily what we're trying to accomplish here. So maybe those are kind of reversed. And then the objectives at the activity level. Strategic priorities is probably the most common term we see for the services or initiatives in your strategic plan. It's the highest level of the strategic plan. Strategic areas is a really nice definition of the service or initiative. Goals, outcome objectives, I like that term. It's, what is the outcome we're trying to accomplish? And then strategies to get to the objectives is pretty good. So that's a nice one. Priorities, pretty good. Goals, objectives, and action steps. Action steps is the most common term we see for activities. Priority areas, goals, again, strategies kind of in the wrong place, and action steps. Priorities, goals, objectives, and strategies, good one. Strategies, strategic objectives. That's the only time I've seen that one, but I like it. Strategic objectives is kind of a higher level objective, and then objectives and action steps. So again, somebody comes to you and hands you this plan and says, Min, go put this plan in the VMSG dashboard, and you look at the names and they're all different. We're going to figure out today how to make all that happen. So then what we're going to do now is we're going to walk through each level of the pyramid, and I'm going to go through some real live examples from public health so you can kind of see where the different levels fit in there. So the groups level is, again, the structure of your health department plus, the major plans. And typically the major plans are what FAB calls their six-pack of plans. So typically you're going to start at the department level as your level one group. And then underneath that, you might have something like community health reporting to one. So you'll see it's a level two group. Potentially under community health, you might have something like WIC. So WIC is reporting to community health, which is reporting to the department. There's a lot of cases where WIC reports directly to the department as well. So it would become a level two group reporting to the department at level one. And then your high level plans are typically independent groups. Now, something like your strategic plan can encompass some of the other plans, like maybe your emergency operations plan or your QI plan is part of your strategic plan. So that can vary. Your CHIP is typically a high level plan, so it's typically a group within itself. And then we're going to use the reference that we did before, the Tobacco 2023 programs down here. So the group that we put down here is Tobacco 2023, and you saw that at the bottom of your group screen here. So again, groups are, typically part of the organization or a high enough level plan that you have to use all the different levels in it. Services or initiatives. Here's some just, again, real examples from public health. Now, these are what I call buckets. The plans around healthy moms and babies, in this case, will be in that bucket. They'll fall under these services or initiatives. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities, and again, we'll use the example today of tobacco cessation. So if you look at these, they're not really actions. They're mostly just a definition of what's going to be within this section of the plan here. Now, the next level down is where we get into the actions here. Now, goals are a high-level definition of what we're trying to accomplish. Goals typically start out with an action verb and a few words to define it, like reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then again, reduce smoking in high schools. Now, the thing to take away from a goal is typically that it's not really, really specific, like reduce smoking in high schools. You sure get an idea of what you're trying to accomplish, but what it doesn't tell you, again, is which high schools. It doesn't tell you how much. It doesn't tell you when you're planning on doing it. So the goals, again, give you the idea of what we're trying to accomplish without the details. The details start down here at the objective level. And again, SMART. Specific, measurable, attainable, realistic, and time-based. Now, I realize there's several other definitions of that same thing. That's the one that we use. And typically, we just focus on specific, measurable, and time-based. If it's not realistic, why would you go after it? If it's not attainable, why would you go after it? So think of specific, measurable, and time-based. So here's some examples. By December 2023, our time-based, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So our specific is the strategies, and 2 is our measurement in there. By December 2023, 80% of educators and school staff have been exposed to ACE awareness education. By June 2023, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, All programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then our example for today, reduce smoking at Wayne High School by 25% by the end of the school year. So each of these examples really is very specific. There is a way to measure it, and the time base. When are we going to accomplish this? Now, to get to our objectives is where we get down to activities. As we talked about earlier, there's 3 definitive types of activities in the dashboard. The most common one by far is the project-based activity. This was the only one originally when we designed the system. And then as we went along, we found that there was needs for other types of activities in there. A project-based activity is exactly that. It's a project that you're going to complete within a time frame. So our project in this case is we're going to create training content and materials for students and faculty on the dangers of smoking. So what I'm thinking is I'm going to create some PowerPoints. If I have the capability to create videos, I will do that. Maybe some user guides for the students, that sort of thing. So the content. Every activity's got a performance measure. The performance measure is simple. How do I know when I've successfully completed the activity? So think of yourself as a third party reading that activity and asking yourself, how will we know when we're done? Well, that one's pretty simple. I'm creating training content. Once I've created the training content, I'm done with it. We're typically going to, at least initially, assign a date range. So this is when we're planning on creating the training content. Real world happens. This thing may, COVID comes along and it extends the dates out by a couple of years. That happened a lot, obviously, over the last couple of years. So those dates can be varied as you're updating the activity. We're going to do team assignments. So we're going to have the team lead, the team members, and those email notifications. Same thing, we're going to do partner assignments. So those external partners in there. Metrics or measurement, in this case, is just how far along are we, percent complete. Now, there's several different options that I'm going to go over when we actually enter this into the system here, so you can see all the different variations of each activity. So that's our first activity, is a project-based activity. Our second type of activity, and it's kind of maybe a little backwards because this is the least used type because it's very, very specific. The QA activity does 2 things. It repeats. So we have a frequency in there that we're setting. In this case, it's monthly. The frequency can be anywhere between weekly and every 5 years if you wanted to. Typically, we don't see this used more than maybe once a year as at the outside, quarterly, monthly, that sort of thing. Monthly is usually pretty good. So what we're saying is we're going to measure the number of training sessions we provide within each monthly time frame on the dangers of smoking to students and faculty. So because we have all this information in here, we're also going to be able to set the traffic lights automatically with this particular activity. The other ones are, for the most part, a manual setting of the traffic light. So in this case, we're saying if we get to our target of 9 training sessions, we're going to set the light to green. And then we just set a red value there. The red value is, in this case, we just said if it's 6 or less, it's going to be red. And then we just let the system calculate the 7 or 8 for yellow in there. In this case, we have a cycle start date and a frequency instead of a cycle start date and an end date. So the end date is always going to be the frequency plus the cycle start date. So in this case, it's going to be May 1 through May 30th, and then June 1 through June 30th, et cetera, as you're going forward. And that way we can use those beginning and ending dates to calculate our percent complete, that sort of thing. Our performance metric in this case is created for you. We'll show you how that happens here. Training sessions provided, measured monthly, and then our green, yellow, and red values. And then again, we'll do the team assignments, partner assignments, and then our metric in this case is just how many training sessions did we provide. So if I go in at the end of the month and say, hey, we did 9 training sessions, boom, the light turns to green, and we move forward to the next month. The third type of activity, the quantitative measurement activity, this is almost identical to the project-based activity with one exception, and that is that we have a target number. So in this case, 20 tobacco vendors. We're going to contact, all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. So now that I have a target number, the reason for that is that I can easily calculate the percent complete, right? I'm going to say if we did 10 out of 20, we're 50% complete. So it's pretty simple. In this case, we're going to have the same date range as we do in the project-based activity. And our performance measure, you'll see, will be created for you. 20 tobacco vendors contacted between May 1 and June 30th of 2023. And then again, team and partner assignments. And as you'd expect, our metric in this point is just how many vendors did we contact. So if I put in that we did 10 vendors, it's going to calculate 10 divided by 20. says we're 50% done. If we do 20 vendors, it says we're 100% done. So those are the three types of activities. Now, at the bottom of each screen, we had the tobacco-related planning elements here. So let's put those together in a plan. So our group was tobacco programs for 2023. The initiative we're working on is tobacco cessation. Our first goal was to reduce smoking in high schools. The objective here, the SMART objective, is reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through that we believe will get us there. Create the training content, provide the training sessions, and contact those tobacco vendors. Now, we could also have then another goal of reduce smoking in colleges. And under that, you'd expect we'd have a SMART objective to reduce smoking at Wright State University by 25% by the end of the school year. So this is what an operational plan looks like based on the different criteria that we just set in the pyramid. Now, what we're going to do now is we're going to use this template. And I just sent this to you, Min, so that you can forward it to everybody. I've sent you a blank version of this. But what we're going to do is we're going to take the information in this template and we're basically going to copy and paste it into the system. And that way you don't have to watch me type and it'll get through pretty quickly, but you'll be able to see everything that we have to do. Now, this is the same exact program we've been talking about. This template, by the way, was created by one of our clients in Wisconsin. And the reason they like the template is because they put the plan in the template before they put it in the system. They forwarded it around to all their people and just got everybody's input on it. And then they went and put it in the system. You can do that. That's one way to do it. But if you enter it directly in the system, you can always go in and edit it, move things around. It's really a simple process here. So either way, but this way it makes it easy to kind of demonstrate entering the plan in the system. So you notice up here at the top, it says your service or initiative, and it gives you a little definition here. I kind of like that. What bucket of work or priority does this relate to? So that's that, again, that big bucket, tobacco cessation. Our first goal, what is the pie in the sky or the high level goal? Reduce smoking in high schools. Then we get down to our SMART objectives. Specifically, what and when do you hope to accomplish? Who's going to be leading the charge? The activities, what are the steps you will do to accomplish the objective? Our performance metrics, how will I know when I've successfully completed the activity? Then you got your activity leads and team over here, who's responsible for doing and updating this activity, and then our time frames. So now what I'm going to do is go live into this template here. So it's a Word document, so it's real easy if you guys want to modify it. And a lot of times what you'll do is copy an entire page into the next page, just make a duplicate of it. So then you can go on and create the next service or initiative goal or whatever you happen to be doing in here. So let's go ahead and start by entering our service here under the new group I created, tobacco cessation. So you're just going to copy it. So I like to use keyboard shortcuts. Control C will copy it. Go back over, to our plan here. I'm going to go down to our group, Tobacco 2023. I'm going to go to our services tab. Now, when I've selected the group and I go to the next tab, the tab is specifically for that group. So I'm going to look for services or initiatives specifically for the tobacco program. I got two choices. I can either click on this big button. Basically what it does is block you from entering anything until you hit the plus button. So this is a plus button or this is the plus button. I'll click on here, opens up the field. I'm going to hit Control V as in Victor to paste it in there, and then I'll save it. Now, everything that you do down here at the bottom is on your local machine, basically, until you hit the save button. The save button is all that does is quickly pushes the data that you enter down here up into the server. So that's why it's a very effective multi-user system. We can literally have thousands of users on because everything you're doing is local until you hit the button, and then it's just milliseconds to push the data up there. We're going to go ahead and call this an initiative. Again, the initiative just means that it's a future service. So we're planning a tobacco cessation program, if you will. Not much difference other than this checkbox. And when you get down to the activity level, the dates are typically future dates on an initiative because it's something you're coming up with. And again, I'll save that. Now, the other checkbox down here to note is this hide service. What that is basically is an archiving feature. So let's say we did this tobacco cessation program during the last year and we're just wrapping it up. So what we want to do is archive all of the data in there. If I hit this save, the checkbox down here and save it, you notice it grays out the tobacco cessation up there. What that does basically is archive it. So it's still there. If you are a manager level user or an org admin level user, you can see it, you can report on it, you can do anything with it. If you're a normal user, you won't even see it. You'll see in here when we get into the next level that you'll see that I can generate a report as a manager, and it'll say, do you want to include hidden services in there? You get the option to do that. A normal user doesn't even get the option to do that, to see it here. Let's go ahead and uncheck that, save it again, bring that back. So tobacco cessation is our initiative. Let's go back to our template here. And our first goal, reduce smoking in high school. So I'm going to grab it, again, Control C, go back over here. Now, when I go down to the goals tab, again, because I have tobacco cessation selected, it's the goals specifically for tobacco cessation. So again, I'll click down here, hit Control V to paste it, reduce smoking in high schools. Go ahead and save that. Now this is where we have the traffic light here. If I wanted to change, typically, especially in an initiative, a new program, everything's going to be green because you haven't had a chance to slow it down yet or anything. But I can just cycle through the lights here with my mouse. So the gold bar, red, yellow, green. I can save it there. You notice if I change it down here, it doesn't change at the top until I hit the save button. So I'm going to go ahead, I'll save that. The other option I have is just to use the drop down here. So I can just go and pick it. You know, people like different things, so we put both of them in there. So I'm reducing smoking in high school. Now let's go down. I think there's another goal down here, reduce smoking in colleges. So let's go ahead and grab that. Control C, go back over here. Now, in order to add this one, I'm just going to hit the plus button down here. Opens up my field at the bottom. Control V, paste it in there, save it, and there we are. So let's go now. One other thing. Since we have two goals on here, and if I wanted to go to the objectives for the first goal, I can either select the first goal and hit the objectives tab, or we have a drill down arrow over here. The drill down arrow in this case would say select reduce smoking in high schools and go to the objectives tab. So I'll click that and boom, there we are. I'll go ahead and open the bottom up again, go back over here, scroll back up to the top, and let's go ahead and grab our first objective, reduce smoking at Wayne High School. Again, Control C, go back over here, Control V, go ahead and save that. Now it's going to appear up at the top. So I have a couple of different options here we'll go through. First of all, the next thing you're going to probably want to do is assign the objective lead. The objective lead has got kind of two jobs. Number one is to get us to this target of a 25% reduction. So program manager, project manager. And the other one is going to be to update the status. Well, currently the status down here says objective percent done, which is really not what we're trying to track. What we're trying to track is our percent reduction. So if you click on the title down here where it says objective percent done, you can change that. So I'm going to change that to percent reduction. I can leave it as percent as my measurement unit, which appears after the blocks. But I do have two choices. If I'm measuring something that is a widget, a car seat, a training venue, something along that line, I can say decimal. And it's just basically, instead of measuring percent, it's going to measure items or units here. I'm going to go ahead and say percent for now. So down here, I'm going to say, hey, let's say we are at 20% reduced right now. So I'll save that. Go ahead and save it up here. You'll notice that our status comes up here at 20%. Now, a couple other things we can do. Number one is assign the objective lead. So I click the little drop down arrow here. Now you'll notice nobody's in this box. The reason is because the first thing it looks for is people within that group. Typically, when you're entering a plan, you're entering it within your division, your office, your program, whatever. So the other people who are typically going to work on it are going to be in the group. So it makes it easy. But in this case, I'm going to say show all users. It's just going to go ahead and show me the whole list of people in your group. They are sorted alphabetically by last name. So I'm going to go ahead and pick on Min today and put him in there. So Min is now the objective lead. Again, two jobs: get us to the target and keep up on the status. By being the objective lead, Min is also going to be the email notification for the objective. So on a regular basis that you guys set up, he's going to get an email to be able to go right back into this objective and update the status pretty quickly. So that is our first objective. Now I believe we have another objective: reduce smoking at Desert Vista High School. Control C. Go back over here. Let's go ahead and add a new objective. Control V. We'll go ahead and save that. Now we have our two objectives. I'm going to go back to our first objective. A couple of things over here. As you're updating plan information. Typically, you're going to want to put a note in there because you want to communicate with the other folks as to what's going on. A couple of options when you're putting note in here. It says, this is a test note. I can just type in a note in there and save it. The other thing I have the option of, which is kind of nice, is to be able to put a date and timestamp. So it's got the date, the time, and system admin's my username. So in here, I'm going to say, a date and timestamp note. So you got the two different options in there. If I enter a date and timestamp note, it puts the note right above there. So it's always the top one up there. So that's my notes in here. Now, down here at the bottom, we have the ability to add a data source. The data source is typically where am I going to go to get the information to understand where we are in reducing smoking at Wayne High School. You know, it could be the Wayne High School webpage. It could be something on the CDC webpage. Let's go ahead and enter a data source. So I'll click on this button down here. So I'm going to go ahead and just say the CDC Smoking Cessation Fast Facts webpage. There is such a thing, by the way. I don't know the entire link, so I'm just going to put the link to the CDC webpage in there. When you put a link in here, you need to start out, if you're going to a webpage, it's got to be HTTP or HTTPS for secure, / and then the webpage. So it's www.cdc.gov. And I'll go ahead and save that. Now you notice down here that description you typed in shows up so you know what you're looking at. And then this little link button shows up. I'm going to go ahead and save this again. The link button down here is going to pop open a new browser window and take me directly to that web page. So in this case, it's the CDC web page. It could be, like I said, the CDC Smoking Cessation web page. Could be the Wayne High School web page if they're tracking that, whatever it is. The reason for that is if I'm going to update this plan, wouldn't it be nice to have the data that I'm going to use to update it at my fingertips? That's what that's all about. You can enter data sources at the goal, objective, and activity level. So if you think about it, you can have lots and lots of different data sources. And ideally, you want it to go directly to that page that you're going to use to update the information in the system here. So that is our first objective. Now let's go ahead and go back and grab our first activity. I titled these, or I put a little in brackets, project-based QA and QM activities. So we're going to go through each of these in pretty good detail. So Control-C, create the training content. I'm going to go down and just drill down to the activities, open it up at the bottom, paste it into here, create the training content. We got the three different types of activities here. This is a project-based activity, so I'm going to go ahead and leave it at that. I can also select the other two if I wanted to. Now I'm going to have a performance metric. Again, the performance metric on the project-based activity is manually done. How do I know? So I'm going to go back here. I think I put it in here. So yep, training content material has been created. Control-C, go back over here, just paste it in here. Control-V. I'm going to go ahead and set up a beginning and ending date. So I can either type it in here or I can use a little calendar button here. I'm going to go ahead and say January 1 through January 31 of 24. I'll go ahead and save that. And again, the measurement on this particular type of activity is going to be % complete. So down here is my current status. Now, what I might do down here as I'm updating this information, say I'm putting the building the training con over time. Let's put a note down here. It says completed chapter 1 of 4. That tells me that I'm about 25% done. So I'm going to put in 25 in here. Go ahead and save that. Now, the next thing I might do is go in and say, hey, $204, and we'll mark this at 50%. And we'll go ahead and save that. And you can see we go all the way through until we get to 100%. When I get to 100%, the traffic light turns to gold automatically on this type of activity only. So this is the basics of this project-based activity. I've got the time and date in here, or I've got the date in here. I've got the time, date, stamp notes. And as you're updating information, so I changed the light to yellow because John is retiring at the end of the month and we don't have a replacement for him, something like that. I'll put a note down in here for that so everybody knows why Fred changes to yellow in here. Now, the other options here, this is the activity wizard, so I'll open that up. So a couple things, I can enter the beginning and ending date. Either place is identical, doesn't matter. But I do have different data entry types. So let's say we were going to be completing this training content in 1 week, and I just want to go in and say, hey, I'm done with it. I can use this option down here, the complete, save that. Now you notice our percent box now changes to a checkbox. If I hit the checkbox here, it makes it 100%. So unchecked is 0%, checked is 100%. You'll notice the light turned to gold up here as well. If I save that, now it'll turn to gold up here. So we know that we've completed that particular activity. That's one of the options. The other option you see here is yes, no. Some activities you'll find can be answered with yes or no. If you do that, it's going to give you another checkbox over here. Yes, and yes is 100%. Unchecked or no is 0%. So it just gives you those options in there. Save that. Okay, now the next thing we're going to do is assign a team of people to this particular activity. To do that, it's this pencil icon next to the activity leader and team members. I'll click on that. And again, because there's nobody in the tobacco group, we're going to go ahead and open it up to the whole department again with this. Either one of these 3 black X's up here will clear the filter up here. So basically it gives me everybody down here. So I'm going to go ahead and let's see. We've got 3 columns. Team member, which is exactly that. You can have multiple team members. Typically you have 1 team lead, and then you have the email notification. If I click the team lead, it checks all 3 of them. To be a team lead, you have to be a team member, and probably you're going to be the person to update the emails. Now I can change this email notification to somebody else, but typically it's there. And I'll go ahead and pick a couple other folks in here to be team members. So I've got 1 team lead. I got the team members in here. Hit the save button down here at the bottom, and here they show up. So I've got Dominique as the team lead, and the blue around there indicates the email notification. Team member, team member. So this is our team of people who are going to be building the training content. That's one thing. The other thing we have is the ability to add external partners. Well, you guys don't have any external partners yet in your database, but it's very simple. The left side of the screen will be the partner organizations at great detail. You can have all the names, addresses, all that kind of stuff in there. The right side will be each contact that you have within that organization. So I can check, be a green checkbox up here, maybe a green checkbox. I can either assign the organization or specific contacts within the organization to that activity. I can assign as many organizations and as many contacts within each organization to the activities I want to. So these are all the folks that we're working with to create the training content. So that is our first activity. That's the project-based activity. Again, it's the simplest type and by far the most common type that you'll use. Now let's go back and grab our second activity here, which is the quality assurance activity. That's the repetitive one that sets the traffic lights automatically. Control C, go back over here. Let's hit the plus button to add the new one. Control V. So we're going to provide 9 training sessions each month. Again, this is a QA activity, so I'm going to go ahead and just select the QA. When you do that, it pops open the wizard for you. Here's your frequency selection. I can do anywhere, again, from weekly to every 5 years. In this case, we say we're doing 9 training sessions each month, so I'm going to select monthly here. I'll go ahead and leave the start date as today in there. Now, this is where I determine the values to set the traffic lights. Go ahead and say, we know that 9 is our target, so obviously if we do 9, we're going to call that green. You can pick any number you want, but here I'm just going to use 6 as my number for red. And then you'll notice it calculates the yellow for you. Greater than 6 and less than 9 is yellow in here. My metric type in this case is going to be training sessions provided. Now, when I save it, you notice it creates a performance metric for you over here. Training sessions provided, measured monthly, are green, yellow, and red. So that basically is what it is. Now, you'll notice the traffic light over here is red. It's red because we're sitting at basically 0 with an empty field here. If I put a 8 in here and click off, you'll notice it turns to yellow, and then I'll go ahead and save this activity, and it'll show up right underneath here with the yellow light. So this is the QA activity. Again, depending on your input during the monthly cycle here is going to determine what the traffic light is in here. You will typically go in and assign activity leaders and team members and potentially external partners in here. You got the notes and comments field. You got the data source field. Now let's look at some of the options on this particular one here. So you saw the frequency is an option in here. You can change that. Your start date is an option. One of the options that's not real obvious is here. There are some things where lower is better. Use the example of a golf score. I know you guys are going to come out to Phoenix and golf and use up all our golf courses here. You want to be lower, right? So what you're going to do to change this is I can click on the greater than or equal to, but to do that, you need to clear out these two fields first, because what it's going to do is not allow you to put in a larger value in the wrong place. So if I clear these two fields out, hit this, it'll go to less than or equal to, this will go to greater than or equal to, and then you can say, if it's less than or equal to 3, it's good, and if it's greater than or equal to 6, it's bad, something like that. So that's basically the option that appears in there. There's another option in here called the timeline option. We won't be going into this one today. This is the one that is used to track documents typically. So in this case, what I'm going to do is put in a timeline for an annual cycle. Let's say I'm tracking policies that have to be updated every year. So I'm going to go in and say on an annual basis, we have to update this policy. I'll put in whatever start date I want to start the annual cycle in here. And then I'm going to put in here what we call a percent to yellow. So what that does is during the annual cycle, when I get 80% of the way through the year, the light turns yellow. When the light turns yellow on this activity, it automatically notifies the person who's responsible for it. In this case would be the activity lead to go in and do the update on this particular document. So it's really a kind of a cool tool to be able to manage standard operating procedures, MOUs, policies, that sort of thing. So that's what that one's all about. That's the option in there. Go ahead and change this back to 9 and make this monthly and take off the timeline here. Save that again. Okay, so that is our QA activity and all the different options that you'll see in there. Now let's go ahead and get our third one, the quantitative measurement activity. Contact all 20 tobacco vendors. Control C. Back over here. I'm just going to add a new one. Save that. Okay, this is something I want to show you. After the first time you save a QA activity, it's going to come in and say, do you want to update the cycle start date? Now think about that. If I just go in once a month and enter it at the end of the month, I'm going to say, yeah, I want to update my cycle start date to the next month. So in this case, we're sitting at December 11th. I want to maybe update it to January 1st, let's say. So I can go in there and say, either, I don't want to use current in this case because it's going to set it back to the 11th here. So I could say select and I can put in, it'll automatically go to January 1st, but you can put in any starting date that you want, or I can say, no, I'm going to leave it here. The reason you might say no is because I'm still going to enter data this month. I'm not done for the month here. We'll go ahead and say no. So now it basically saves that activity here. Okay, now let's go ahead and add our third activity, that QM activity. All right, copy that. Go ahead and hit plus, Control V. Okay, contact all 20 tobacco vendors. I'm going to call that a quantitative measurement activity. Again, we open the wizard. So I'm going to go ahead and use January 1st through January 31st again. My target number, as you can see up here, is 20. Decimal or dollars? Exactly that. Decimal is widgets. Dollars is dollars. So if you use dollars, everything's going to have dollar signs and 2 decimal point and that kind of thing. Our metric type in this place is tobacco vendors contacted. And then I have 2 data entry types. We'll go over here in a second. The first one is enter a value to add to total. That's the default. So I click on this. It creates my performance metric. Says, how we know when we've completed this? Well, when 20 tobacco vendors are contacted between 1/1/24 and 1/31/24, we've completed it. Down here is where I'm going to enter the number of vendors. So remember it said pick a value to add to the total here. So let's say I put in 5 that I did this week. It takes and moves it down to our total here and calculates that to be 25% of the 20 that we're trying to contact here. Go ahead and save that. So let's say the next week I go in and add another 5 in there. And now we're at 50% done. We'll save that. So what we're doing is adding to the total. What it does is just keep track of it for you, the total. So you're just adding how many did I do last week or last period, whatever it happened to be in here. Let's look at some of the options on this particular one. Again, we talked about decimal or dollars. The other data entry type here is enter a new total value. And when I do that, you'll notice the summary field goes away. Where this would come in handy is if I'm going to contact all 20 tobacco vendors within a week, and at the end of the week, I just want to go in and say, I contacted all 20 tobacco vendors. So basically, it just gives you the ability to have one data entry, or you're keeping track of how many you've done to date, something along that line. So that's those two different options. There is another kind of a hidden option in here, and that is what we call a zero target. So when we have a target of 20, it becomes the denominator for our calculation of percent complete. So 20 divided by 20 is 1, obviously, or 100%. I can also go in and say, I want to make this a zero target. And what's going to happen is the percent field goes away because you can't divide by 0, as you well know. So what we're saying is here, I just want to count during this month how many widgets we did or how many tobacco vendors. I don't have a target number. I'm just going to go out and start contacting them. So basically, it's all it's going to do is just give you a field. You can use it either this way to enter the total value yourself, or I could go down here and select this one and gives me the total. So I can say, I contacted another 5 folks in here, so I'm at 25. So at the end of the month, you can go back and see how many we did. So it's just a way to keep track of things that you don't have a target number for in there. So those are the 3 activities that we believe are going to get us to our target of that 25% reduction. Now let's go back and look at that plan in the pyramid here. Okay, so our group was Tobacco 2023. We had 3 initiatives under there. We selected tobacco cessation. We had multiple goals. We selected to reduce smoking in high schools. Our SMART objectives, reduce smoking at Wayne High School by 25% by the end of the school year, and then the steps we're going to go through to get there. So that is the operational planning process. Again, every plan fits into this model. As you will see when we get into the performance monitoring training, you can actually, on a report and any output, like the web output, you can change what these groups appear on a report. So if you're using, priorities for services or initiatives, there's a place in there that you can actually change that. It's called a synonym. Basically, what it's going to do is when you print a report, instead of saying your service or your initiative, it's going to say your priority is. So it just gives you the ability to revamp these if it makes sense to do that in a report. Sometimes you have fixed reports that you have to generate for the state or for emergency operations, something along that line. So we allow you to actually change that when you're doing the reports in there. Now, that was what I had planned to go through today. What I would like everybody to do now for our next session, which is the review of the operational plan, is I would like everybody to go in and Min has the template, so he's going to send that out to all of you. If you want to use the template to create an operational plan, did you get that, Min, that I sent you? Okay, good. If you want to use the template, please feel free to use the template exactly as we did there. If you'd like to go put it right in the system, please go into the groups here and then go down to the training group. And the first thing you'll do is go to your services. You hit the plus button. You'll enter your service or initiative. And if you would, please, in parentheses after that, put your initials. That way we'll kind of know who everybody's done. You can do both, by the way. You can create it in your template first and then go in and enter it into the system. Or if you just want to leave it in the template, if you're not comfortable going into the system and entering it, put it in your template. When we do the review, we're going to give you superpowers and allow you to actually enter it into the system with our help to actually walk you through the process of entering it. Some people really, really learn well by doing. So we kind of give you that option as you're going through it. So, and by the way, it doesn't have to be something business related. It can be anything you want. We've had anything, and currently this time of year is planning Christmas parties, planning my time with my kids. Somebody was planting grass in their backyard, so they did a whole plan to do that. Just all kinds of fun stuff like that. So if you want to do that, please feel free to. You can start out with one service or initiative, one goal, one SMART objective. And if you can, think about trying to use the 3 different types of activities, something that makes sense in doing the the project-based, the QA, and the QM activity in there. So that was the plan for today. Questions?
I have a few questions. Yes, I do, if you don't mind, Fred.
I don't mind at all.
So, so when we worked towards our strategic plan coming up for 24 to 27, we worked together as, a group. And would you recommend, since we have majority of our strategic plan done in a way, do you recommend having one person inputting, the goals, the objective, the activities, which we call our benchmarks and the tactics for consistency? Or would this be something that you would recommend for each individual managers within the division to input that themselves?
I would have one person. I mean, it's a copy and paste if you already have it on paper. So just let one person get it in there, and then go through and figure out who you're going to assign the objective lead and the activity lead to the different managers in the organization. But yeah, just copying and pasting. And by the way, if you got something you want to send me to get started, I'm happy to get it started for you.
Okay, excellent. I'll keep that in mind.
What else?
And you say for training number 3, this will be more of a smaller group session?
Yeah, well, we can fit all of these folks fit in there. We typically like to limit it to 6 just to do the time. And, if you go in and put it into the system, it's a couple of minutes for each person because we just basically go through and review it. If we're going to allow you to copy and paste it into the system, then we take a little bit more time to do that. But, this group could be in the next session real easily.
Okay, excellent. I'll keep that in mind.
Anybody else have any questions or anything else you'd like to see before we go?
Can we get the recording of this training?
I've got I got it being recorded right now. As soon as I'm done, I will post it up on YouTube and send you the link.
Perfect.
Thank you so
Fred.
much.
Thank you, everybody. I hope you have a wonderful day.
Thanks, Fred. I'll be in touch to schedule training number 3.
Thank you. Yeah, thank you. Give people about a week. Typically, they've got real jobs to do and not just entering stuff in VMSG. So give them about a week to come up with a little plan. I would really appreciate it if everybody will come up with something because it really is a good learning experience for you to do that.
Absolutely. Sounds good.
Thanks, everybody. Bye-bye.
Thank you, Fred. You take care. Bye-bye.